on behalf of Ashton Fairchild, Lanisha Jean-Pierre, and Carmen E. Rosa. My name is James Wolfenden, and we represent the University of Central Florida School of Social Work. We are presenting a group project on practice theory, and we chose the Existential Theory. Our professor is Marina Dare. For the background and case scenario for our client, she is a 22-year-old Filipina female that comes from a wealthy household. The client is currently in a long-term relationship for about 6 years. The client currently is working as a waitress and DJ at a restaurant, and she has no college degree as she decided college would not be for her. As I said, she comes from a wealthy household, but her parents are divorced due to her mother's alcoholism. The client's main support system, at least through the family, was her grandmother. They had a very strong relationship, but unfortunately she recently passed. Continuing with the background and case scenario of our client, she is seeking services because of problems at work. She has gone to work while under the influence of alcohol. She has caused several fights while employed there, especially on shift with other employees she may not see eye to eye with. She reports she's becoming belligerent and violent, especially after her drinking, which is also leading to her becoming physically ill throughout the day. The client is self-reporting that she has been unfaithful to her partner of 6 years and having trouble staying faithful on a consistent basis. She is feeling stuck as a waitress and DJ, and feels like she's losing the meaning in her life. The client has been affected by the very high conflict divorce from her parents, and she's noting increased feelings of anger, along with her feeling sad, hopeless, and anxious about her life, the direction it's taking, and whether or not she can find meaning in where she's at. Some background on the existential theory and therapy. It has 4 major concerns or parameters of life that all people are said to go through at some point. They include death, the freedom or responsibility, isolation or loneliness, and then meaninglessness. The focus of existential therapy is to help the client improve their awareness of these parameters so they can come to terms with them and decide how to best live their life. The focus of existential therapy is on the individual's experience and their unique perception of their world, the self, their relationships, their meaning, and their purpose of life. Existential therapy is centered in the present and utilizing the past to explain some of the present behaviors, and also relies on the client's abilities of self-awareness, determination, and responsibility. The key is to getting the client to make these changes and choices themselves. Continuing on existential theory and therapy, can help aid the client to increase their self-awareness. This can help the client relieve their feelings of being stuck and refocus the attention on what she thinks of herself, her beliefs, and values. Can also help guide the client into making meaningful action towards her goals, choices, and decisions that can lead to the life that she ends up wanting to live. The freedom that comes with responsibility and existential theory can help guide the client in learning how the consequences of her actions affect her physically and mentally, both of those areas of her life she's currently having trouble with. And then through the use of Socratic questioning, the client can be guided to find meaning in her life and working through those feelings that arise from her parents' high conflict divorce, the death of her grandmother, her issues at work, or anything else that's currently been troubling with her issues with alcoholism and depression. Regarding the effectiveness of existential therapy on clients with these issues, found a few research articles that talks about just that, including the effectiveness of existential therapy based on ontological core schemas on rumination and mindfulness of depressed women. This is a randomized clinical trial design that focused on rumination, which is the repetitive negative thoughts that can lead to depression, and mindfulness, which is creating awareness, focus, and acceptance of thoughts. And the Freeburg Mindfulness Inventory and Ruminative Response Scale were utilized. And this study specifically showed that existential therapy sessions led to decreased rumination and increased mindfulness. Then also in the effectiveness of cognitive existential group therapy on increasing hope and decreasing depression in women treated with hemodialysis. This was a study that focused on the hopefulness and depression on women, which is the client in our case study specifically. And then it used the Miller's Hope Scale and the BDI to collect and analyze data. And then this specific study was able to show that the increase in hopefulness and decrease in depressive thoughts and feelings came from the combination of existentialism philosophy and cognitive approach. They used this for 12 sessions. Additional research on the effectiveness of existential therapy includes how existential therapy may help people who are suicidal. The suicidality are common concerns that lie in existential thoughts and worry that deal with meaningless and isolations, those pillars that we talked about earlier. This study assisted clients to accept the responsibility for their choices, and it leads to the power of choice being a deciding factor between life, death, and living a healthy and happy life. Existentialism was shown with a combination of psychology and philosophy to reduce the ideas of suicidation. Additionally, the existential therapies, this is a meta-analysis of their effect on psychological outcomes. This was a review of the evidence of the efficacy of existential therapies. The psychological interventions that they included centered around the themes of meaning of life and death, and then these appeared to be overall beneficial for these populations. The most multifaceted approach recommended psychoeducation, exercise, and therapy. Additional research we have found involves a case study revolving around Thomas attending 18 sessions of existential therapy, confronting fears of existence and living life to the fullest after he feels as though he's starting to waste his life. This article, entitled Struggling with Meaninglessness, a case study from an experiential existential perspective, explains the therapist initially forming a strong alliance and asking Thomas to clarify his goals for therapy. Thomas explained he has unmet meaninglessness in his life since childhood, and the therapist shifts towards a meso-macro dimension to aid the discovery of what matters to Thomas in his life. This gains encouragement and helps Thomas to live regardless if it has ultimate meaning or not. Additionally, the existential impact of high conflict divorce on children focuses that the divorce, especially when it's high conflict, can have a destabilizing impact not only on the children but the adults as well. This article proceeds to explain how children impacted by the trauma of high conflict divorce are high risk for development in internalizing and externalizing these disorders. And it also shows that existential psychotherapy can be applied to both the adults and children in these high conflict divorces. The techniques used in the article assist the client in rediscovering their meaning in life through key existentially orientated questions. Another article we found entitled Existential Psychotherapy in a Deep Cultural Context, the Case of KO, shows a doctor named Dr. Shapiro applying the existential therapy model to break the cultural barriers and unpack his client KO's experience thus far in his life. They are struggling meeting their sister for the first time after not knowing that they existed and believing their family has been cursed by their father's actions. After 24 sessions of existential therapy, KO is able to face his fears, lift the curse from his family, and gain the ability to make deep connections to his culture and his community. This existential psychotherapy technique worked for Dr. Shapiro and helped address KO's belief system and his fears to the unknown. The final two research articles we will present also highlight the effectiveness of existential therapy on a case study such as ours. In the journal article Substance Abuse, Existentialism, and Anger, it is discussed that women in the study were not self-aware of their anger and its effect on their substance misuse and alcohol abuse. These participants were denied in the presence of significant early anger and when first presented to them by researchers. Over a 3-week span, the participant acknowledged they could benefit from additional work in the area of anger and research, identified anger as one of the key factors of substance abuse, and also prior to both the researcher and participants acknowledging the existence of their anger and their substance abuse, they were able to apply the theory of existentialism affecting the day-to-day behaviors and substance abuse. It identified 3 basic patterns of unhealthy anger management: aggressive, passive, and passive aggressiveness. And then finally, the article entitled Applying Existential Theory and Intervention to Career Decision-Making highlights how, in our case scenario, the client expressed discontentment with her current identified careers. The author of this article states when individuals aren't satisfied with their employment, it is caused by the absence of their career providing meaning and the presence of contributing factors to their community or functionality of the world in general. If their career decision lacks the existence of the aforementioned factors, the individual may begin to experience an existential vacuum, leading to this therapy being very beneficial. The author expresses how the resources of career counseling can assist individuals that may be experiencing these feelings, just as the woman in our case study. This begins our first page of references. And this concludes our references. Thank you for your time for watching our presentation. We hope you enjoyed our project on existential theory and therapy. Thank you.